So we're joined by Professor Ronan Sullivan, Head of Paediatrics at the School of Medicine and Medical Science in University College Dublin and Consultant in Paediatric Emergency Medicine at Our Lady's Children's Hospital in Crumlin. He is also Scientific Chair of the Local Organising Committee for ICEM 2012. So Professor O'Sullivan, from the viewpoint of an ICEM delegate, what can they expect to get out of the conference in terms of their continuing education?
Well, I think your ICEM delegate will get a world-class standard conference in emergency medicine. That's really the benchmark that we've aspired to, and we feel we've put together a scientific program which reflects the breadth of emergency care, but also really a who's who of emergency medicine, ranging from pre-hospital care right through to research and education within emergency medicine from around the world. And we've tried to structure the individual tracks within the meeting according to the patient's journey through the emergency care system. So from the pre-hospital environment, which is one track, and that includes things like disaster medicine, through to when the patient arrives in the emergency department and may need resuscitation, and within resuscitation whether they may have a trauma resuscitation or a non-trauma resuscitation, through to what we call initial assessment and things like triage within the department, rapid assessment, majors care, what we term majors care, which would include conventional topics like cardiology, respiratory emergency medicine, neurology, mental health emergencies. We have a dedicated track for pediatric emergency care. And then the so-called sort of back office functions of an emergency department are crucial to how emergency care is practiced, and we have tracks that are fully dedicated to that around quality of care in emergency medicine, research in emergency care, education in emergency departments, and training of emergency physicians and other practitioners. So we really think we've captured the full gamut and breadth of emergency care and everything that's attendant with that within the meeting.
And this all revolves around the theme of the meeting, which is bridging the gap between evidence and practice. How does that overall theme work within each track?
Yeah, so I think what we've asked our world-class panel of speakers to consider when they're delivering their talks is giving the average audience member an up-to-date précis, if I could use that word, of the latest evidence within that particular area. So that, there's so much evidence being generated within medicine and emergency care that it can be difficult to keep up to date with this. And many of the people who are delivering the talks will be the people who are actually generating the evidence themselves. So it's really a fantastic opportunity for people to hear the evidence, to be brought up to date about their practice, and I suppose to quiz and to be in an environment where discussions can ensue and where it's almost like a melting pot of ideas and getting real life guidance as to how to optimize your own care of your own patients within your own department.
You mentioned you have some of the top experts and leaders in the field. Are there any personally you would have that are must-sees on that list?
Certainly. I think when you look at, let's say, the quality track, we have absolutely world leaders like Professor Art Kellerman from the RAND Corporation in the US, who has been an advisor to presidents in the US. Chris Bagley, Prof Bagley from Australia, is the Chief Medical Officer for Australia. We have, I suppose, absolute world leaders in terms of things like clinical guideline development, like Professor Ian Steele from Canada, Pat Croskery, again a world leader in patient safety in medicine. I could go on. Ron Walls, world leader in air.
So they're all must-sees, really.
We've been incredibly lucky that the people that we've reached out to have been so enthusiastic about the meeting, and it's allowed us to put together what I feel is a top-class program.
And as the scientific chair for ICEM, you would have seen many of the abstracts that were submitted yourself. Were there any areas where people seem to be particularly excited about and focused on?
Yeah, I think we had over 1,000 abstracts, which is, I understand, the largest amount of submissions ever to an ICEM conference. And really those abstracts reflect the breadth of emergency care, again, ranging from resuscitation and trauma through to pre-hospital care, to pediatric emergency medicine and administrative emergency medicine and so on. Really what was very impressive as well was the range of countries that the abstracts came from. It really, I think, genuinely reflected the ICEM community, multiple different countries from different backgrounds.
And of these cutting research and specific tracks within the scientific program, which do you personally see as growing in the most in importance over the next 5 to 10 years?
I think, if you're asking me this from an academic point of view, I think the areas of quality of care around emergency care and how we deliver emergency care, and the whole area of what we term comparative effectiveness research, trying to work out what we do in emergency care and putting value to it. That's probably one of the most crucial areas in which we need research, and in which real high quality research is being produced. Of course, translational and clinical research is always going to be very important in emergency medicine, certainly almost above other specialties, you could argue, because of the nature of what we do. And I think emergency medicine is continuing to develop high-class emergency care. One feature of the meeting, for example, is that the Pediatric Emergency Research Networks, which is a global pediatric emergency research network collaboration, has got a day-long breakout track where it will present some of its cutting-edge work and will offer nascent and established pediatric emergency medicine researchers an opportunity to meet other researchers and to develop sort of global research.
You've also been closely involved with the pre-conference workshops. Can you first tell me what workshops someone setting out in the world of emergency medicine should attend?
Well, I think again the workshops are probably a microcosm of the conference in general, and that we've aimed for a breadth of type of workshop. There are, for example, workshops like the Advanced Airway course from the UK. There's a day-long workshop on pre-hospital research, which is being supported by the Falk Foundation from Europe. Medicals, which is a 2-day course, which will be the equivalent of an ATLS course for trauma, and is an immersion course, which is outstanding for learning about medical emergencies. Simulation in emergency medicine is very much a hot topic, and we're providing a 1-day introduction to medical simulation in emergency medicine. And then, again, we're very lucky to have colleagues like Eddie Lang and Roddy Seapole from Canada, who are leaders in evidence-based emergency care, and they're offering a workshop on the use of the internet for evidence-based practice. Again, a hugely practical and fundamentally important tool in the modern era where so much information is being produced via the internet.
And moving away from the scientific program to the social program, what can delegates expect from the ICEM 2012 social program?
Well, I'm assuming they're expecting a bit of crack, and I personally I've been known to socialise on occasions, and I'm looking forward to it myself. I think looking at the compere for the night, Barry Murphy, even though he probably won't be known outside of Ireland, his name is easily recognisable here, and we're hugely enthused. He's a comedian and a bit of a raconteur, and I think will be an outstanding compere for the night. The rest of the entertainment, for want of a better word, provided by acts like Extreme Rhythm, who are an Irish percussionist music group, and that I suppose have a modern take on Irish music and Irish dance, almost kind of bringing something like Riverdance to the next level, where they're providing an exclusive 25-minute show for delegates, and that's going to be, again, I think, an absolute showstopper. I would be astonished if people aren't coming to the meeting and expecting something spectacular, and we're not going to let them down.
And I believe you have reasons to raise a glass in celebration yourself?
Yes, thanks very much. My wife has just given birth to her 5th baby, a 4th girl, so we're tired, we're coping. In fact, I shouldn't even be telling my wife that I'm doing this because I'm supposed to be at home minding the baby. But no, we're great, and we're exceptionally happy. So thanks very much for that.
Lovely. Professor Sullivan, thank you very much.
Thank you very much.